When this health insurance client came to us, there was a couple different things they actually needed from us. One was they needed scalability and additional agents that ultimately had 100% content and quality accuracy. If you're verifying specific procedures, you got to make sure you're 100% accurate because if you misquote something, that can be very expensive. They needed 5-star to be able to hire, recruit, train, and then ultimately retain these agents because the longevity of the team was very, very important to them. So they needed scalability with high caliber agents. They also were struggling with some of the technology that was needed to be put into place. With the high content accuracy, they needed additional technology that could help review more inquiries than a manual quality evaluation person could do, where they were reviewing about 5 to 10% of calls, where 5-star has tools and tech that can ultimately review all inquiries, making sure we're handling calls with the utmost care and with the highest accuracy possible. 5-star is able to build a specific job a description for this client and find people with healthcare insurance related backgrounds. With our ability to hire and recruit in 30 plus states in the US, we're able to find very high caliber agents that had the experience that they needed. This specific client was hiring recruiting in one location with all agents having to work on site. Working with 5-star, we were able to expand their hiring pool significantly. Training is very unique for this client because of the amount of knowledge and content that's needed to be absorbed. The training really focuses on using your resources, being able to pull them and know where to look for specific things. Even if you think you know an answer, you actually have to pull up an insurance plan. 5-star agents have to use 22 systems for this client. So agents had to know how to navigate all of these tools. The specific client is working on integrating all of those tools. But as a healthcare vertical knows, as you acquire different groups, sometimes those legacy systems take a while to transition. So 5-star agents are very nimble, very content and policy driven. We actually started with the basic inbound policy procedure questions with 4 agents and grew that team to 30. We then branched off into other departments of this health plan facility and started doing some outbound outreach for some proactive patient scheduling, then actually worked with some billing offices as well. What's great is it started with a pilot, but ultimately has grown to 3 different departments with 50 plus agents. This client specifically was great because they kept their internal team and then 5-star had our team. What we found was once we combined everyone reports, 5-star actually mixed and matched with similar results to the internal team, which very much surprised the client. So as they actually treated agents internally, they actually moved them to 5-star knowing the results we would produce would be very similar to their internal team.